Hi, everyone. Good afternoon. Thank you for joining us yet again today for our weekly Science Talk webinar series. We are wrapping up Research Thrust C today, which explores how cities can intentionally foster the widespread adoption of infrastructure, development patterns, consumer behaviors, and management practices that advance sustainable water management. Next week, we're going to hear from Director of UN, Dr. Maz Zakarabi, when he provides an update about the Urban Water Sustainability Blueprint, which is designed to conceptually synthesize the network's research activities. As most of you know, we are recording these webinars and I post them to our YouTube channel and UN website. Feel free to use the chat queue, or if you prefer, you could turn your mic and webcam on at the end of the presentation to engage with Dr. Harlan. So with that, I am excited to introduce Dr. Sharon Harlan, Professor of Health Sciences and Sociology at Northeastern University. Dr. Harlan's research explores the human impacts of climate change that are dependent upon people's position in social hierarchies, places in built environments of unequal quality, and policies that improve or impede human adaptive capabilities. Focusing on excessive heat and urban water systems as significant and increasingly critical threats to human health and well-being in cities, she studies social systems and landscapes that produce unequal risks for people in neighborhoods divided by social class and race or ethnicity. And I believe she has some additional representation from Northeastern as well. So I'm going to turn it over to you, Dr. Harlan, to introduce your colleagues.
Thank you, Sarah. I'd be happy to do that. And welcome to everyone. I see some friendly photographs here, so nice to see you. So I want to introduce my two guests today, Martha Davis and Laura Senior. They have been collaborating with Mariana Sarango and me since 2019, when we began to examine the health effects of high and escalating water bills in Boston and Chelsea. Martha is University Distinguished Professor of Law and co-director of the Program on Human Rights and the Global Economy at Northeastern. Her writing on human rights and social justice issues, including the right to safe, clean, accessible, and affordable water, is well known in the legal community. So Laura is Associate Professor of Sociology and Health Sciences at Northeastern, and her experience with studies that identify political, social, and economic barriers to the translation of research into practice is important for understanding how governments at all levels address or fail to address water affordability. So my plan is they are going to join in at the end of the presentation and have some discussion about what they've been doing and how we're thinking about water affordability. And I hope that Mariana is also going to join us. Maybe Laura, if you could try to text her or something or email her, because I sent her the link, but I don't know if she really got it.
Okay.
Well, with that, I am going to try to share my screen. Let's see how this works. Oh, no. Screen 2, screen 1. Yes. Okay. Can you see that?
Not just yet. Did you click the last share button?
Probably not. I get confused. Teams and Zoom.
I know, switching through these is always a challenge. Okay.
There we go.
All right, we see your slide deck. So if you want to throw it in presentation mode, you should be ready to go.
Okay. How about that? All right. Okay, so my presentation today is divided into two parts. The first part will be a retrospective of the UN C31 project over the 6 years, affectionately or popularly known as SIEGE, or Social Equity and Environmental Justice. It's organized by the frameworks and the 4 objectives that we set out in 2016. And I'll highlight some of the research and publications that Liz Mack and Mariana Sarango and I have worked on without going into too much depth, because they're all available for you to read if you're interested. In the second part of the talk, I want to focus on a few SIEGE studies on unaffordable water bills for low-income households. This issue first came to light for us when Liz did her seminal 2017 study called A Burgeoning Crisis and Nationwide Assessment of the Geography of Water Affordability in the US, showing that at that time, 12% of households had water bills that exceeded EPA's affordability criterion of 4.5% of median household income. And at the end, so the second half, and that's where I'm going to invite our guests to add their commentary. So back to the beginning, the SEACH project contributes to integrating equity and justice principles into the research, education, and engagement of the Urban Water Innovation Network. And some of you might recall that the inclusion of this project came to pass after the other thrusts had been formulated. So the mission for Liz Mack and myself was to infuse awareness of social equity and environmental justice across the network. And one of the first things we did was conduct a survey of the investigators, all 43 of them, and we received about 70% of responses. And what you told us was that the best candidates for doing SEACH research were floods and thermal stress, or the urban heat island. Not surprisingly, given the investigators on the project. And we have done that. I will come back to that. And we have also touched on these other issues too, and especially pay attention to this, the cost of water, because at that time, not many were talking about that. The other important piece about this survey was that we asked other investigators, are you planning to include these justice issues and equity issues in your research? And you can see by a large majority, people said they were, and they did. So this is not just about what Liz and I and our collaborators did throughout the project, but what other people did as well. So all along, I have framed this project in the science and environmental, science and social movements of environmental justice. And there are three principles here. The first is distribution, right? Equitable distribution of water burdens and benefits for vulnerable groups. And we have the tools in science. We have GIS and we have census data and we have mapping to study distributional justice. And actually quite a few researchers do spatial studies. Many of you do that. The second principle is recognition of the historical and cultural context of oppression of certain groups in society. And there hadn't been so much work done on that. But in the last couple of years, you know, with the emergence of Black Lives Matter and other movements, is once again placed systemic discrimination and racism front and center in the public consciousness. And more researchers are paying attention to those narratives of Black, Native, Latinx, and Asian histories in America, and starting to examine the origins of where these injustices come from. The third principle is participation, or in the Environmental Protection Agency's phrase, meaningful involvement of affected communities. And this remains a goal and an aspiration of community-based research, citizen science, community partnerships that are very important to all of us and in the UN network. And in this project of C31, within the limits of our resources, we did try to pay attention to all of those principles. A second framework that's important here when we think about studies of water is just the notion of just sustainability. So it is the idea that a sustainable society needs to take into account questions of social needs and welfare and economic opportunity. It can't be an afterthought or second class. It has to be that meeting the needs of the most vulnerable people today have equal worth alongside protecting the environment and the economy. So that's the second framework. And then the third framework actually predates UN, because in 2010, the United Nations declared water as a human right for every person in every nation. But during the course of UN, the mission has become louder and more insistent as the UN adopts sustainability goals to ensure access to water and sanitation for all, and declaring the International Decade for Water to mobilize action on how we manage it. So these are frameworks that, larger frameworks that we keep in mind as goals of everything we try to do. So in the SIEGE project, we had always 4 goals or 4 objectives that we said all the time. And one of them was going to be to train undergraduate and graduate social science students to participate in and lead these multidisciplinary projects. And I believe that's one of the best accomplishments that we had, because we have had 25 undergraduate and graduate students at 5 different universities here and at Michigan State, and at Georgia State, Tim Stevens, and at Florida International, we had Tim Kirby. And we had the URP undergraduate summer research program that funded these 5 great undergraduates that we were really pleased to work with. And here at Northeastern, we actually had other grants from National Science Foundation and National Institute for Environmental Health that funded 7 different students. And some of the students who worked on this were even unfunded. So I think that we were pleased with the outcome of objective number 1. Second objective was to collaborate with UN climate and flood researchers to highlight SIEGE issues. And I tried to list here as many things I could find that Liz and I worked on with people on this project. And I think, you know, if you're scanning the names, you're going to see pretty familiar names here on a lot of these. And I see some of you are on the call today. So thank you all for being our collaborators. And I'm going to highlight just 2 of these studies as I go through the results. So that was our other objective. Okay, the last 2 objectives were to conduct 2 original research projects for SIEGE on water-related issues. And this was to bring community leaders in urban households into the project. So one of the things we did was the survey of water indicators and socioeconomic status of households, known as Swish. And you'll see in 2 of the studies, 2 or 3 of the studies I'm going to talk about, these survey data figure prominently. There's this arrow here because our 4th objective was to widen the spectrum of participation and influence of community groups on water decision-making with the stakeholder groups at UN. Numerous attempts at that. Mike Suko will bear me out, I think. We tried. I don't think we succeeded as well as we could have with that. But one of the projects we did in C31 was to interview grassroots community leaders in the UN regions. And I'm going to highlight a little bit about that report today too. So the first study I wanted to say a little bit about is from collaborations with UN floods researchers. And this has been an article that was published in a special issue that Brian Bledsoe co-edited. And Tim Stevens is his student who is an author on this study. The idea here was to study what variables predict the public's perceived risk of floods to themselves and their families. And so we examined the associations of flood risk perceptions with the location of their home relative to flood plains, social vulnerability characteristics like income and race and age and gender, and their life experiences and attitudes toward government and their communities. So we know from our floods researchers that floods are deadly, costly, and increasingly common. And urban floods in particular are becoming major challenges, both due to sea level rise and due to river and stream flooding during storms. Now, the experts tend to measure and evaluate flood risk based on data and calculate risk based on probabilities. And they want and hope that people are going to behave in certain ways to minimize their risk. So what we wanted to know is whether the households that we were surveying would really evaluate risk in the same way. So the question that we had was, how do people perceive their own risk, the same or different than experts perceive risk? And in particular, and the part of the paper that I want to just highlight today is whether socially vulnerable groups have different kinds of flood experiences and adaptive capacities than more privileged groups, which might affect how they perceive risk. So we use the Swish data, which you can see took place in regions across the country. We had the 6 UN regions, and we also added to it the places that Liz Mack and I and Brian Bledsoe moved to after we began the project. So now we have 9 regions here and representative of over 1,700 zip codes and over 9,000 respondents. So this was an online Qualtrics survey. And what we did when you have a non-quota sample, we weighted these respondents according to the census characteristics of where they live, so that we're sure we're representing attitudes of the non-white population and the low-income population. So we had a good distribution, enough cases to compare attitudes across all these variables. So here we see some of the artistry of the cartography of Tim Stevens, who used the FEMA floodplain maps in these areas to show what is the mean percent of developed land, meaning where people are living, in floodplains across these urban regions. And you can see here that Miami, the Miami region is an outlier. And then these are the percents for the other region. We used the Swish data to ask people if they had experienced a major flood in the past year. And this would be something where something at their home was damaged by a flood or water entered their home. And you can see these percentages. And again, Miami is at the Southeast Florida region is at the top. These data on risk perception come also from Swish. And I want you to just notice that the measure is something that's pretty standard in the literature about how you measure risk perception, which is a combination of what you think is the probability that this flood is going to happen to you and how serious you think the consequences would be. So it's measured on a scale, and then in the map are depicted the distributions, and it's pretty much a normal distribution, except in Miami, again, where they have a lot of flooding. So that's kind of the baseline that we're looking at. So here I want to, this is a very complicated paper. I just wanted to highlight some results about differences between people who we call the haves and the people who we call the have-nots. So we developed this indicator of whether the respondent had health insurance and then whether they said they had enough money to pay for these 4 essential goods. And so the sample was divided about 2/3, 1/3, 1/3 being the have-nots. And so these next results, I'm going to show you just a list that compares how have-nots and haves perceived flood risks. So first of all, on the dependent variable, the have-nots perceived higher flood risk than the haves. And they were more likely to have experienced the major flood in their lifetime, and they were more frequently tuned into news about floods. And those two variables were the predictors for the have-nots of flood risk perceptions. On these variables here, there was no difference in whether the haves and have-nots were living in a floodplain. The have-nots had less confidence in institutions, less self-confidence in their ability to cope with floods, and they were less likely to believe that their neighbors could solve problems. So, but here's another important point about this. None of these variables predicted flood risk perceptions for the have-nots, but they did predict risk perceptions for the haves. So more highly educated, high income, more privileged people make these nuances in how they think about risk, but the have-nots don't. So this gives, I think, flood scientists and managers some things to think about in terms of challenges about how we are communicating risk to the have-nots and how we're thinking about people, the have-nots evaluating their own risks. They weigh their own experiences and news reports more heavily than anything else. And I don't think most people have a good idea of whether they are living in or close to a floodplain. So that's the first study that I wanted to highlight. The second one just came out this year, finally, after much effort on the part of the authors. And the idea of this study was motivated by the goal of producing evidence-based guiding principles on where to implement targeted heat-reducing measures that prioritize an equitable distribution of urban thermal environments. So quite a lot of work has been done by some people on this call on trees and the benefits of trees for cooling low-income neighborhoods. But we chose to look in this paper at cool roofs in the water-stressed environment of Maricopa County, Arizona. So cool roofs are reflective roofs that dispel heat, reflect heat back off of the outdoor environment. And they also have the ability to cool buildings, we're finding. But in this paper, we were just focused on outdoor temperatures and the impact that cool roofs could have in a city or an urbanized area. So the principle of equity that we agreed upon for this principle was the difference principle of distributive justice. And that is that fairness in the distribution of social goods, in this case, cool roofs, should be remedied to the greatest benefit of the least advantaged members of society. So that was how we determined it. So I think maybe the shortest way to convey what we were doing here is the graphic abstract that Ash Broadbent made. And so you see that the idea here is that marginalized and heat-sensitive communities often reside in the hottest parts of cities. And we know that to be true across many cities because a lot of researchers look at this. The idea is then that some kind of infrastructure that reduces heat in these cities can protect them more. So to do this, we had to develop a heat sensitivity index using census data. And this is a strategy that we've used in the past, looking at the population and where the vulnerable population determined by income, minority status, age, all those variables that would make people sensitive to heat, where do they live? So you map the area and then you use the urban climate model, which is WRF in this case, a very fine scale to try to match up where it's hottest with the sensitive neighborhoods. And then you can use that model to figure out how much heat was reduced in different parts of the city. So there's some really nice graphics in this paper. I'm not going to show them just to save time, but we found a couple of things. One is that when you use this needs-based or targeted urban heat reduction strategy, the cool roofs can provide twice as much cooling in the highest heat sensitivity areas than in the lowest heat sensitivity areas. And that's not in small part because they have a higher roof area. And that's in no small part because they don't have open space and trees. So in this case, it turns like a disadvantage into an advantage when you want to think about a heat reduction strategy. And the other thing is that when you look at this on a population basis, you actually provide more person hours of cooling in the highest heat sensitivity areas because they're more densely populated. So for both of these outcomes, it's interesting. You can achieve the maximum benefits of this cooling only by installing the roofs in those areas. So if economics are a concern, you can target this relief and achieve as much benefit as you can almost by cooling the whole city. So that's the second paper. Third study I want to mention briefly is switching gears to the fourth objective about hearing community voices. So we did these interviews, and this a whole group of students at Northeastern worked on these interviews, and very labor-intensive coding of all these interviews to draw out the thematic themes. And we found some similarities and some differences of what these community grassroots leaders were saying compared to the UN researchers and how the communities would prioritize their water hazards. So polluted water is the number one issue on the number one hazard on their list. And floods and unaffordable water and lack of access to waterfront recreation for low-income minority populations is part of this as well. So we did the report, and this is one of the graphics that came out of it in terms of how these leaders perceive barriers to a just and sustainable water system in their cities. And these are structural barriers, if you notice, which has to do with racist housing practices of past and present. And then how water ties into a market logic where there is a profit motive they perceive and a prioritization of corporate interests in pricing water and investment in water infrastructure as well. So commodification is a barrier, and also institutional and regulatory failure of not including other voices in terms of prioritizing what's important for the health and safety of communities. So let me just pause there for a moment, take a breath. If you have questions, I would say put them into the chat about this part, and then we can talk about those later. But I do want to get on with the last part of my talk, which is just a few more slides before I open this up to discussion. So here is the Swish data again. And this is where I want to talk about the increasing cost of water as the number one public concern. Now remember, this is like 10,000 people across the United States, and using the same risk perception scale that we did for floods, we asked people on this scale, you know, what is your risk perception? They weren't comparing these to each other, they were separate questions. And you can even see that floods are on here, but they are not people's number one concerns generally, except in Southeast Florida again, where they get a lot of floods. So if, you know, looking overall at the combined risk, so the desert cities perceive a lot of risk. And then, you know, we can go on from there, but really water is a significant concern because all of these are scoring like above the midpoint on the scale. But the thing I want to note here for this purpose is that cost increase, you know, across the board, it's like right at the top. So bearing out Liz's study. So Mariana's study that she did, one of her studies for her dissertation, was looking for traces of racism in the affordability of water. And indeed, what she found is that if you look at where people live, and this x-axis here shows proportion of the census tract where people live that is minority, that is Hispanic and Black, then you say that the higher quartiles of people who live in those areas are more likely to have unaffordable water bills, so 7.6%. Shutoffs are the same. Now we learned about shutoffs, we heard about these in Detroit a lot because they've had over 150,000 people have their water shut off, but shutoffs we learn are a tool that other municipalities use to punish people for unpaid water bills. So that too is more common in higher minority areas. And this is true even when you control for the characteristics of the respondents. Okay, so it's an ecological effect and it's also a household effect. Now Liz did another study from the Swish Data, which she talked to you about in her webinar last semester, that these prices do really have consequences for families in terms of deciding how to spend their money. And they impose financial burdens on people, and especially those have-nots, households. They force people to make difficult choices. In her hypothetical scenarios, even a water bill increase of $12 a month could force people into making choices and force them to cut expenditures for essential goods and services. So again, the lower income households were 11 times more likely to say that they could not afford essential goods if their water bill increased. And this was true, more true of minority households. And you note here what they said they would reduce spending or could not afford are these essentials: healthcare, heating, and prescription medicine. So just to note here, and we'll get into this more in the discussion, I think, that these increasing prices of water for households are intimately connected to the increasing costs for water providers, so that aging infrastructure, rapid urbanization, climate change that increase the cost to providers then increase the cost to consumers. And this plays out through this whole chain of events to where we make it to these household decision making, and then the health and well-being of individuals and the human right to water. So finally, Mariana's another study, two other studies she did in her dissertation actually took the Swish data and looked at these same issues about when people perceive that their water bill is unaffordable, what is that correlated with? And what it's correlated is with, as they say, they're food insecure, they can't access healthcare, and they have poorer health. So these are some quotes from interviews that she did about how these high water bills and rising prices affect people's health and well-being, and it's both physical and mental health. So I'm going to end there. And at this point, I would like to invite my collaborators. I think Martha is going to say a little bit about this first question about what the obligations are of governments. And Laura would like to say some things about the barriers that municipalities face when they're trying to develop programs to make water affordable. So what if I just stop sharing my screen? I don't think we need these questions up here anymore. And then we can see each other. And let me go ahead and talk. And Martha?
Thanks, Sharon. Yeah, shall I go ahead?
Yes, please.
Thank you. That was super interesting. So thank you for letting me sit in on that. So I'm going to say just a few words without slides about what the sort of legal superstructure is that governs issues regarding water affordability. And as Sharon mentioned, the United Nations has recognized the human rights to water and sanitation as two separate rights. Initially kind of dragging its feet, but ultimately it's accepted those rights as well. But, you know, international human rights are not enforceable domestically, typically. But they do, you know, it does have some influence on you know, sort of the legal status and also how people feel about the need for water and whether or not it should be recognized. There are some state constitutions that include statements regarding water and the right to a healthy environment, which you would think would include water. New York has one that was just added in last November. Montana, Massachusetts, Pennsylvania, a few others. But those are none of them that I know of provide a private cause of action. So again, there's sort of statements of principle that may influence what kinds of state laws are enacted, but they don't provide an ability for people to go to court and challenge water unaffordability. There's a California statute, not the Constitution, but a statute that recognizes a human right to water. Again, no private right of action, but the implementation of that particular statute mandates consideration of water impacts of policies that the state adopts, and also includes a provision that mandates collection and reporting on data regarding shutoffs. That is still being implemented, as I understand it. It was complicated by COVID with moratoria, you know, that meant that there weren't any shutoffs for a period. And so, but it's on the books and something that is being implemented at the local level in order to comply with state laws. So water quality standards are established and monitored by the EPA, as I'm sure you all know, but affordability is not regulated at the federal level. There's guidance that the EPA offers, but no mandatory standards that are applied. And so affordability is regulated primarily at the local and regional level with some input from the states. In some states, and maybe Laura will talk about this, mandates equity in setting water rates. And unfortunately, in contrast to the notion of equity that Sharon was talking about, that has been often interpreted by local governments and by state attorneys general to disallow cross subsidies between consumers. So it's an idea of formal equality rather than looking at the results, you know, that would really be true equity. And it makes it difficult then when states have adopted that interpretation to provide assistance to those who cannot afford water, but who, like everyone, still need it. And of course, that inability to allow cross subsidies can have a disparate impact, disparate racial impact. So the result of this rigidity is that there are states that have adopted, or local utilities that have adopted customer assistance plans. Those can be very rigid. They don't target those in need because that might involve cross subsidies. Local governments have, or local utilities have established charitable responses, but which have finite amounts, you know, so don't, again, have the ability to respond to everyone in need. And that leads then to shutoffs or even liens where people lose their homes as a result of not being able to pay their bill and have that fed into a tax system that leads to liens. So as as Sharon mentioned, some of Mariana Zarango's work provides suggestive data indicating that these approaches have a disparate impact on people of color. In addition to the data that Sharon talked about, there was a study some years ago in Boston of shutoffs that indicated that even controlling for income, that shutoffs were being focused on BIPOC individuals. And so we've got, you know, some indication of this. You know, there are legal issues that are raised by that. Title 8 of the Fair Housing Act bars discrimination in the provision of access to household water, including disparate impacts. But even under the Fair Housing Act, it's still a pretty high standard to meet. And without information, about exactly how shutoffs or liens or so on are being administered, it's very hard to identify that disparate impact. On the other hand, that information would not only be fodder for lawsuits, but also would help utilities frame their programs in ways that are responding to actual need. And I'll say one more word is that in our looking at this, there's also in general, in most places, but not all, a failure to provide assistance to renters who typically, disproportionately are people of color. And so there's several ways in which the law, has some structures for addressing this, but there are some barriers to using law to address it too, through legal interpretations of the issue of equity, and then also lack of availability of data. So I'll stop there and turn it over to Laura.
Thank you.
All right. Thank you both, Sharon and Martha, for that review of some of the things that we've been grappling with and that I know the UN network is intimately familiar with. Martha asked me to talk a little bit about the research that Sharon asked me to talk a little bit about the research that the three of us have been doing under a National Science Foundation grant to study water unaffordability in major US cities. So under this project, Sharon and Martha have already described to you, we've found that cities have really widely varying policies on shutoffs. Like some will shut off water, some will not shut off water, some will put a lien on the property. There are all these different varying mechanisms that they use for punishment for people who can't afford to pay their water bills. There are also, there's a lot of variation also across cities in terms of the customer assistance plans and what they try to do to help residents who may have difficulty paying their water bill. Some of them may give a discount to seniors, some of them may give a discount to disabled or disabled persons. Some of them discount just the water portion of the bill and not the sewer. Well, some will discount the whole thing. Some will give just a flat rate of rebate. Some will allow people to structure payment plans. There's all this heterogeneity in these customer assistance plans. So, obviously I know that a lot of you are familiar with what Philadelphia has done in the pricing of water to try to make the pricing more affordable and more equitable. But it's obvious that a one-size-fits-all approach is just not going to work everywhere. So it's important for us in this project that we're working on to understand why we see so much variation across those customer assistance plans. And because these are the most prevalent mechanisms that cities are using to safeguard the right to water and make water affordable, we want to understand sort of what are some of the best practices there and what are the things that might end up producing racial inequities and how might the city managers who are responsible for managing these water utilities, what kind of barriers are they facing and what are they doing to get around these barriers? Before I actually dive into some of our findings, I did want to bring up something that Susan DeLong brought up in the chat, was this tension between water quality and water affordability. And, engineers are out there developing new methods or water treatment and municipal water systems and could end up driving the cost up. We heard lots and lots of things about this, frustration about this from the people that we were interviewing in our sample, and they talked at length about the difficulty of trying to manage these costs. The systems that they're managing, they have fixed costs that they need to manage their systems. They have new regulations that are coming online from EPA that are going to continue to drive the price of water up. So while a lot of water managers will preach the doctrine of conservation, how important it is to get people to conserve water, it's also true that there are a lot of things, fixed costs in the system and new technologies that are going to drive the system up. And it's not really realistic to think that we're going to conserve our way out of the problem of unaffordability. With respect to the barriers that we have identified so far in the interviews that we've done, and we are studying 12 cities and towns in Massachusetts and Pennsylvania, we have found some barriers that relate to organizational capacity at the city level, which means the level of resources that the city has dedicated to the department that's managing the water utility. One of the things, for example, that we have uncovered, and obviously a lot of people know that when we talk about water infrastructure, there's pipes and there's actual hard infrastructure and water treatment plants and filtration, but there's also sort of a soft infrastructure that has to do with IT systems. So we have found that very few municipal water officials really understand within their billing system which customers are most likely to have trouble paying the bill and what happens to them. And that really is a big barrier to crafting customer assistance plans that will be able to reach people. We also found that they talked a lot about how city departments are really siloed, and that makes it hard, for example, for the assessor's office, or the Treasury office, which is responsible for collecting bills, to communicate with the water department, which is actually issuing the bills. And when people have difficulty paying the bill, they end up getting shuttled from one place to another, and it becomes difficult for departments to communicate and collaborate on developing more equitable and easier, more transparent policies. We also found, however, that some of the barriers are sort of ideological. And one of the things that a lot of people said, frankly, they need to balance is that the city needs money in order to manage the water system, and that they're trying to balance that against the vulnerabilities of people in their community. And I talked earlier about the notion that we have fixed costs. The government just needs money in order to manage the system. And ideologically, it may not be possible to help everybody. There's this very capitalist mind frame that water is a commodity and that people need to pay for it. And then there's also sort of some ideas that we have encountered in the interviews about deservingness, like who deserves to have a break on their water. So, when it comes to things like elderly people or senior citizens or blind and disabled people, those are groups that have kind of already been approved, if you will, by other social institutions as being worthy of some kind of break or some kind of benefit, and that the water department is sort of trying to figure out, like, we're just going to follow everybody else's example and everybody else's lead on that, as opposed to trying to think for ourselves, what does the human right to water per the UN mean for us in our context? Strategies that they have been using to try to overcome. We see a lot of organizational learning and mimicry from one community to another with respect to community water plans and assistance plans. We also see a lot of mimicry across different kinds of utilities. So, a lot of people, for example, say, well, we do use water shutoffs, but we don't shut water off during the winter months. And when we've asked why, they've said, well, that's just what the gas and electric utilities do. They don't really have a good reason for it, but there's a lot of mimicry that happens. And there may be ways to use some of that mimicry to nudge people towards more equitable processes and transparent processes. We also have found that a lot of communities rely on consultants to help them develop new pricing structures or new customer assistance plans. And it may be possible to do some outreach and education with those consultants and with the professional associations that the utility managers belong to, because those are important channels through which they learn about more progressive or more transparent policies. I think I'm going to stop there because I know that we are coming close to time, but happy to answer any questions you may have.
So thank you to both Martha and Laura. Sarah, do you want to go through these? There's quite a few comments in the chat, which to have a discussion. Do you want to?
Yeah, I can field those. Okay. I'm just going to start at the top then. So first comment from Dixie here. Thanks for joining us, Dixie. She's a former CSU staff here. So earlier, being able to afford housing, health insurance, medications, healthcare, food, gas, electricity, etc., were used to define haves versus have-nots. Was being able to afford water bills just assumed to be likely if a household could afford, aka have, the other criteria?
Okay. Now, there are various definitions of affordability used in these papers. No, in this paper about the floods, there was a criterion. So, Mariana, are you
I think she's on, yeah.
Do you recall, Mariana, how we defined it in that paper? Let's see.
Sorry, I couldn't unmute myself. I had to step away for a second, but the definition for what was it?
Affordability of water in the floods paper. See, we used a percentage of income in some of the papers.
Yeah, I'm not sure if it differed in that paper than what we used in like some of my dissertation papers, but we used the percentage of the household income. We used an equivalized household income, so it kind of standardized the household income based on the number of household residents as well as the age of the household residents.
Yeah.
So for example, if your water bill to household income ratio for a one-person household would be different than the ratio, the same, same water bill cost and same household income ratio for a four-person household, for example.
Right. So there was there's various definitions of affordability, and different studies use different ones, but it's usually in like the 3 to 5% range of income that your water and sewer bill should not exceed in order to be affordable. And so that's in Mariana's work, those are the thresholds we were dealing with. So it was a measured affordability criterion.
Okay, and I did drop the link to the landing page for your project, Dr. Harlan, in the chat queue, so that should have links to the various publications as well. So Susan was wondering, I think we touched on this a little bit, but I'll just open it up to the broader discussion. If you can share any thoughts or recommendations to researchers and engineers working on new water treatment technologies designed to remove contaminants in hopes of making water safer, but will increase costs. If anyone wants to pick up that thread.
Do we have some other engineers? That's a little out of our area of expertise to think about which technologies. We know, as we mentioned, that is the standards for safe water drive up costs, but how to save on those costs, I don't know.
Laura, you want to pipe in?
Yeah, I wouldn't say so much that we need to think just about it from the technology perspective, like the cost of what we are developing, but I think that we need to start forecasting what is it going to cost, what's the impact of implementing these costs going to be on different kinds of communities. So in the public health arena, we have this thing called a health impact assessment, where if a new policy is approved, it's a method for trying to calculate out like what is the impact going to be on the health of communities. And it may be that something like that could be adapted for the engineering space, where if a new technology is going to be recommended, try to forecast like what would the impact be on different kinds of communities. In our study, we've developed a typology to understand like, based on city size, based on racial and ethnic diversity, based on income. So it may be possible to develop some forecast methods, and then we could decide, well, all right, if this is going to be onerous for certain kinds of communities, then we would tailor the recommendations for implementation.
Thanks, Laura. That's kind of what I was wondering, how folks that are on the engineering side can reach out and collaborate across disciplines to get some guidance on how we can not operate in a siloed fashion. And so I appreciate some of those thoughts.
I'm happy to talk with you offline too, if that would be helpful to follow up on that and think through what some approaches might be like.
Okay, lovely. Thank you.
Yeah, and I'll just add, of course, costs are already going up. There are already people that can't afford water. And so we already have some examples of places that of communities that are utilities that are developing approaches. And Laura mentioned Philadelphia briefly. In Philadelphia took the position that it would be better off to develop structures that people could make minimum payments and actually continue getting their water than be cutting people off for failure to pay. And in addition, that program also incorporates some forgiveness, with minimum payments over time. And so those are the kinds of programs that have been effective in addressing the rising costs. I'll say also that there's currently a funded federal assistance program, the LIWAP program, temporary post-COVID, but something like LIHEAP for water is the kind of thing that that people that we should be thinking about, and certainly water advocates are thinking about on the federal level, because this is because it's a human right and a human need, and it doesn't serve anyone to cutting people off when it's going to result in public health issues and destitution.
Right. And I see that in the chat, Erica DePalma is also suggesting using the state revolving fund to pay for necessary capital improvements. There's a lot of attention right now, obviously, on the money that's coming through to communities through ARPA and the various infrastructure bills coming out of the Biden administration after the pandemic. But there's also legislation pending in Congress that it's called the Water Bill. It's an acronym, and it would bolster the capacity of a lot of communities to pay for infrastructure through the state revolving fund. And then it would also place new requirements on communities to start keeping better track of the data and understand who's getting shut off, how frequently, which communities, which neighborhoods, to start tracking some better data about what's really going on.
Sharon, were you gonna pop on?
No, I was looking down a little bit further in the next two questions. Well, okay, so someone mentions Detroit, and yes, that was I think the catalyst of a realization for a lot of people about what was going on with water affordability. But, I was just looking at the next two questions by Susan and Dixie, and I think those are we were getting into answers to those questions. In the comments that were just made. How should we balance water safety and water affordability? And of course, we want everyone's water to be safe. And I think the water affordability question is really who pays? Who pays when people can't afford? And what are the assistance programs like? And I think we were talking about those. Martha and Laura were talking about some of those issues. I just have the LIHEAP program. I know a lot of people like to use that as an example, but we had such a bad experience with that in Arizona when it came to, the heating and cooling, that it's just, people didn't know about the program. It didn't cover everyone that it could have and should have. There wasn't enough money. Like in Arizona, we wanted money for cooling and it was all going to the Northeast for heating. So those assistance programs really have difficulties, and it's also bound up with, it's not just water affordability, it is energy and housing and this whole complex of things that affect the have-nots, like our definition of the have-nots. So it's requires a more comprehensive thinking about how we think about social needs, and how this country wants to address that. Sorry, go ahead, Sarah.
Yeah, no, I know we got people that are hopping to their next Zoom call, and some of our guests have to jump onto another lecture too. I guess one thing I will do is just plug next week's presentation as well, where we'll be discussing a little bit more about how to bring some of these various components together. So certainly tune back in next week. David, I see your comments about the success of the Cool Roof paper and how it's contributed to your efforts in the city of Phoenix. So that's really exciting. Erica, thanks for your comments and putting some more food for thought out there. And then Aditi is wondering, Sharon, if you have any resources that you might be able to share. She wants to include some of this information in upcoming courses. So maybe I could connect the two of you offline.
Yeah, Sarah, can I get a copy of this chat? Can I save it?
Yes, I will have it as a file so I can send
Okay,
it over to you.
yeah, that would be great. I'd be happy to connect about that or anything.
Sure.
Hello?
Great. Yeah, that sounds great. Okay, well, I think I might wrap us up for the day. If anything comes to mind, feel free to shoot me an email and I'm happy to connect the dots. Thanks for your time, everyone. Hope to see you next week. Take care out there and have a great day.
Thank you, Sarah.
Bye.
Bye-bye.